Hello, my name is Dr. Dewan S. Raja. Today I will discuss about cerebral palsy. Cerebral palsy is a non-progressive neurologic motor deficit associated with prenatal or perinatal brain injury. Prenatal means before birth, perinatal after birth, the time around the birth. The most common motor disability in childhood. The cerebral palsy affects the ability of a child to move, maintain balance, and posture, characterized by spasticity, ataxia, dystonia, ethitosis, like movement like an worm, okay, ataxia, imbalanced, paresis, paralysis, it may be hemiplegia, maybe just two limb paralyzed, maybe quadriplegia. On rare occasion, sleep disorder. It may be associated with blindness, deafness, low IQ, intellectual instability. Even there may be some psychological disturbances. Drooling of saliva, constipation, urinary incontinence, and muscle pain. Prevalence, that is the number of existing cases in the United States, is 1 in 345. The signs and symptoms are not revealed at birth, so it is not apparent at birth. They are manifested gradually as the age advances. Postmortem examinations of children with cerebral palsy displays a wide variety of brain damage, may be caused by infraction and hemorrhage. Okay, so if we look at this brain section, chronic stage of periventricular leukomalacia, large cystic spaces in the periventricular white matter seen in both hemispheres of this brain are the long-term sequelae of a severe prenatal and perinatal ischemic injury. This will happen. There will be degeneration. Okay. So this image has been taken from Robbins Cotton Pathologic Basis of Disease 10th edition. This is another image from Google. It is an image by Natter, and these are the features of cerebral palsy. Motor dysfunction. It may be spastic, it may be ataxic, okay, it may be mixed. So there are many types of, so it may be dystonic, it may be ataxic, it may be spastic, it may be mixed. There are a variety of types of cerebral palsy. The exact cause of cerebral palsy is unknown. We don't know the exact cause. There are many predisposing factors like prematurity, multiple pregnancy, difficult delivery, asphyxia. Sometimes the umbilical cord may be entangled around the neck of the fetus. That may lead to asphyxiation, lack of oxygen, head injury, meningitis, maternal infection like cytomegalovirus infection or other rubella. Okay. Types of cerebral palsy: spastic, ataxic, dyskinetic, mixed. So if it is on the superlateral surface of the brain, it is spastic, more common, 70 to 80%, increased muscle tone and stiffness. tight muscle, it may need sometimes surgery to release them. Okay, even bone may be remodeled sometimes, like pelvis, lower limb. It may be ethetoid when the upper part of the temporal lobe may involve the basal ganglia, so we may have uncontrolled movement like ethetosis. If there is a lesion in the cerebellum, difficulty with balance and coordination, and we may have mixed of all. So most common is spastic type of cerebral palsy. Diagnosis: cerebral palsy is a clinical diagnosis assessing the milestones of development, watching the abnormal body movement, MRI, EEG, electroencephalography, and relevant laboratory tests to diagnose cerebral palsy, because sometimes some other cerebral disease, some genetic problem, some metabolic problem may mimic cerebral palsy. But cerebral palsy, this is a neurodegenerative disorder, but it is not progressing. Metabolic diseases, other genetic disease, it may progress. So we need relevant laboratory test. Treatment: there is no cure. But we have treatment like surgery. It may be releasing the tendon or cutting the muscle. Even the posterior nerve roots are also cut in certain situation. Antispasmodic drug like baclofen, analgesic painkiller may be used. Physical therapy. Okay, so we may need physical therapy. Analgesic physical therapy may be required. Occupational therapy. Okay, so occupational therapy, speech and language therapy, even recreational therapy like that of swimming under supervision, and certainly counseling, that is very important. Counseling, prevention, prenatal care, vaccination by the mom like that of MMR vaccine, safe delivery. These are the prevention, but it may not be prevented. It may not be predicted. Okay, and exact cause still unknown. And that's all about the cerebral palsy. If you have any question, please feel free to ask me. Please share the information with your friends. Please support my channel. Please subscribe me. Have a nice, wonderful and blessed day. Bye now.